VIRTUS trial measured the safety and efficacy of a venous-specific stent in patients who have clinically significant venous occlusion in their legs. And the idea was to look at the patients with clinically significant stenosis, as we talked about, symptomatic patients, and relieve the obstruction or occlusion of their veins after recanalization with a Vici stent. So that was the VIRTUS stent, or the objective of the VIRTUS stent, looking at the safety and efficacy of this stent in patients with clinically significant venous disease. VIRTUS was a single-arm prospective multi-center international study with core lab adjudication of all imaging parameters that included venography, intravascular ultrasound, duplex ultrasound, and an independent clinical events committee that adjudicated all the results. The study was a pivotal study to look at the safety and efficacy of the Vici stent. So it was a regulatory study for approval in the United States. The stent has been available in Europe and the rest of the world, but this was the approval study for the United States to get through the FDA. This was the first presentation of the 12 months data on the safety and efficacy of the VIRTUS trial. And the study was done in two phases, 30 patients feasibility and 170 in the pivotal study. The 30 patient outcome has been presented and published before. This was on the pivotal arm of the study, which included 170 patients looking at the patency and clinical effectiveness of the Vici stent in patients with venous disease. The data showed with a very significant p-value that the treatment of these patients with Vici stent was safe and effective. The patency was significantly better than the performance goals set by the FDA based on the literature in terms of what was expected for these stents to be, what the patency be for these stents in this patient population, and also on the safety side. So there were basically no safety issues. There were 98.8% at 12 months. Actually, the safety was defined at 30 days, but that extended. So a safety margin of 98.8%, and a patency rate for the combined patients of 84%, but there were two different groups of patients that were enrolled in this study. 75% of the patients were the chronic post-thrombotic, which are most challenging group of patients in venous disease, and the other 25% were the non-thrombotic patients who just had symptoms due to venous obstruction. The patency on the chronic post-thrombotic, which is again the most challenging, was 80% at 1 year based on venography, and for non-thrombotics is over 96%. So both of those met the criteria with a highly significant p-value. The study will continue up to 3 years, so we will need 2-year and 3-year outcomes. Obviously, the same patient population will be followed, both in terms of either clinical improvement and anatomic patency. Further beyond that, obviously once these stents become available, they will be applied elsewhere. Now that would be outside of the indications of the stent, but certainly venous disease is not just limited to the iliac veins. Those undoubtedly will be studied. There are features of the stent that need to be studied, and that is once you gain a certain lumen, and this by the virtue of its high crush resistance yields a very circular lumen, which seems to suggest that those patients actually clinically do better. And there's a clinical correlation to the shape of the lumen of the vein to the outcome. And so those need to be studied further. and also correlation of intravascular ultrasound to venography to duplex. This is the only study that has actually looked at that, and that needs to be determined further.